Welcome to Health Facts with Dr. Danesh. In this video, we're going to find out what are the most common persistent symptoms after recovery from COVID-19 infection and how we can actually reduce these symptoms or even treat them before it makes a chronic condition for the patients after COVID-19. But first, some interesting update about COVID-19 pandemic. As of July 24th, total cases of coronavirus infection is 15,656,884, and then total death is 636,576, and more than 9 million people recovered, making the average death rate 6%. And we had the highest daily new cases, 279,857 people in July 22nd, and it seems that we have a second wave in death rate actually, making July 22nd one of the highest death rate in coronavirus history, 7,116 people, even though we have higher death rate, daily death rate before in mid-April, but after 4 months we still have very high death rate in July 22nd, which is 7,116 as mentioned before. Thankfully, we only had 4 deaths in July 22nd in Canada. However, daily new cases in Mexico is on the rise, and in July 19 we had 7,615 people cases in one day. We already talked about how we had a second wave, a typical second wave in Iran starting the mid-May, but this is actually daily death chart. As you can see, in the first wave we had the maximum of 158 people death in one day, but during second wave we have 229 deaths in one day in July 21st. Spain has one of the highest death per million, and the highest death per day in one day was 961. However, daily current death is really minimal. In the United States, we still have high numbers of death, 1,119 deaths on July 21st. In Spain, daily death is minimal. As you can see, only 2 deaths in one day. However, death per million rate is still very high compared to other countries. Second country after UK. United States has the highest active cases, as you can see here, 1,997,033 people. Another interesting fact is that even though the daily death right now in Belgium is only 4 patients a day, total death in Belgium is 9,817 patients, which means 36% of the total of 27,211 closed cases, which means the cases that have an outcome. While the average death from COVID-19 infection in the world is 6%, as you know. In Sweden, the country with minimal restrictions, social distancing, they experienced a second wave, as you can see here. But the cases, the number of daily new cases is going down, and the current daily new cases is far less than the peak in the second wave. The death toll in Sweden is 7%, as you can see, and is close to the average death all over the world, which is 6%. However, almost 100% of active cases are in mild condition. In this study that published in Journal of the American Medical Association in Letters, titled Persistent Symptoms in Patients After Acute COVID-19, they noticed that a large population of patients with coronavirus disease and COVID-19 presented with symptoms. 71.4% of 31,845 confirmed cases as of June 3rd, 2020 have some kind of symptoms. Common symptoms include cough, fever, dyspnea, musculoskeletal symptoms such as myalgia, joint pain, fatigue, gastrointestinal symptoms, and anosmia, which means loss of sense of smell, and dysgeusia, which means loss of sense of taste. They assessed the persistent symptoms in patients who were discharged from the hospital after recovery from COVID-19. Here's their methods. In the waning phase of the pandemic, beginning on April 21st, 2020, the Universitario Agostino in Rome, that's a hospital in Italy, established a post-acute outpatient service for individuals discharged from the hospital after recovery from COVID-19. All patients who met World Health Organization criteria for discontinuation of quarantine, which means no fever for 3 consecutive days, improvement in other symptoms, and 2 negative test results for severe acute respiratory syndrome, coronavirus 2, 24 hours apart, were followed up. So here's the result from the chart related to post-COVID-19 symptoms. It seems that the fatigue is the most persistent symptoms after COVID-19, which could be up to more than 50% of the patients. Dyspnea is the second one, joint pain, chest pain, cough, and so on and so forth. They studied 143 patients between April 21st to May 29, 2020. And they've done the follow-up post-acute care assessment. Patients were assessed a mean of 60 days after onset of the first COVID-19 symptoms. At the time of the evaluation, only 18, which means 12.6%, were completely free of any COVID-19 related symptom, while 32% had 1 or 2 symptoms and 55% had 3 or more. None of the patients had fever or any signs or symptoms of acute illness. Worsened quality of life was observed among 44.11% of patients. 53.1% showed fatigue, and 43.4% dyspnea, and 27.3% joint pain, and even chest pain in 21.7%. They studied the effect of vitamin D3 on fatigue in general in August 2014. The title of the study is Correction of Low Vitamin D Improves Fatigue, Effects of Correction of Low Vitamin D in Fatigue Study. It's published in North American Journal of Medical Science. They studied 174 adult patients who presented in their primary care office with fatigue and stable chronic medical conditions, completed fatigue assessment questionnaires. Patients with low vitamin D levels received ergocalciferol therapy, which is a form of vitamin D, and score of pre- and post-treatment fatigue assessment questionnaires were compared. Results from this study shows that the oral ergocalciferol, which is a form of vitamin D, the 50,000 international unit 3 times weekly for 5 weeks regimen has shown the highest efficacy, which is 82%, without adverse events or toxicity. So they concluded that the normalization of low vitamin D level with vitamin D therapy significantly improves the severity of fatigue symptoms in adult patients who present in the primary care office with fatigue and stable chronic medical conditions, if any. With fatigue being a major presenting complaint in primary care offices, serum 25-hydroxy level should be tested, and low serum 25-hydroxy levels should be corrected with an effective ergocalciferol, which is a vitamin D therapy regimen in order to improve their symptoms. And then there's a study published in July 15, 2020, which is titled Immunologic Effects of Vitamin D on Human Health and Disease, in which they showed the association between low levels of serum 25-hydroxyvitamin D and increased risk of developing several immune-related diseases and disorders, including psoriasis, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, tuberculosis, sepsis, respiratory infection, and COVID-19 has been observed. In this article, they showed the causes of vitamin D deficiency and associated disease with vitamin D deficiency. Also, in this study, they showed the function of vitamin D and its metabolites on the innate and adaptive immune systems. So to achieve the optimal overall health benefits of vitamin D, we need to have the level of 40 to 60 nanogram per milliliter or 100 to 150 nanomilli per liter of 25-hydroxyvitamin D to have the beneficial effect of vitamin D in our health. For example, for a patient over 18 years old, we need 1,500 to 2,000 international unit of vitamin D2 or D3 with the upper limit of 10,000 international unit. But when we have a patient with a vitamin D deficiency, we need 6,000 international unit per day or 50,000 international unit per week of vitamin D2 or D3 for 8 weeks. To achieve the serum 25-hydroxyvitamin D more than 30 nanogram per milliliter, which we talked about. To reduce dyspnea and coughing, which is two persistent symptoms after COVID-19 infection, according to this article, attenuation of influenza-like symptomatology and improvement of cell-mediated immunity with long-term N-acetylcysteine treatment is possible. So NAC treatment was well tolerated and resulted in a significant decrease in the frequency of influenza-like episodes, severity, and length of time confined to bed. Also, N-acetylcysteine is a glutathione precursor. Glutathione is the most important antioxidant in our body. So when you take N-acetylcysteine 600 milligram twice a day, it actually helps to increase the glutathione. So you're going to have less mucus in your lungs, and also is actually improving the function of your lungs. I hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friend and families. And like always, stay happy and healthy. Thanks and have a great day.